I couldn't be more proud to introduce Jenna Kahn, excuse me, to present the virtual medical student elective in the era of COVID. I think we've all been wondering what to do, how to get students engaged in radiation oncology during this time when we have low numbers and we're sort of unreachable by students. So Jenna and crew have thought of a really creative and innovative way to get students interested in our specialty and exposed to all the aspects of radiation oncology in a virtual environment. So thank you very much, Jenna.
Thank you. I'm Jenna Kahn. I'm an assistant professor at Oregon Health and Science University. So with the advent of COVID-19 and the global pandemic, many medical schools have ceased clinical rotations for students. This has left medical students with limited to no access to clinical rotations. And so we sought to create a temporary elective in response to the restrictions on medical students by a virtual elective. The purpose was to allow medical students to obtain some exposure to the field of radiation oncology through a hands-on approach. The objectives of the course include to introduce and have a basic understanding of the clinical and technical aspects of radiation oncology, to introduce the assessment of a cancer patient, participate in contouring and understanding the basics of treatment planning, as well as understanding imaging principles, as well as understanding radiation oncology workflow, and understand the principles of multidisciplinary cancer management. Medical students in the 3rd and 4th year clinical rotations were enrolled in this 2-week course. The students spent initial time learning from pre-recorded lectures on the field of radiation oncology and its technical basis, including intro to radiation oncology, emergencies in radiation oncology, simulation and contouring in radiation oncology, as well as palliative care. Subsequent days focused on sub-site disease-specific lectures that were targeted specifically to medical students, as well as watching videos on physicists, dosimetrists, and RTTs. They participated in departmental educational meetings, and students also reviewed online radiology modules and had hands-on exposure to contouring. This is an overview of the course schedule. Students were given this path and schedule. Most of the videos are already recorded, so it's self-paced throughout the course. We have bi-weekly office hours to discuss cases and review questions and contours. Medical students were invited to our daily department contour rounds, which is where we review all cases prior to planning. And case presentations by residents are given 4 days a week, which are about 30 minutes going over a specific topic. Chart rounds are once a week, and resident education is 2 to 3 times a week, and all medical students participated in this. This is an example of the sub-site lectures, which were pre-recorded and targeted towards medical students. They are 30 minutes each, and there are 8 sub-site lectures. Additionally, students watch videos of a physicist explaining how a LINAC works, a dosimetrist explaining treatment planning, and a radiation therapist explaining their role in setting a patient up as well as their treatment. Students were assigned 8 to 10 cases to contour and given clinical vignettes to go along with the contours. Those contours are reviewed by myself and my co-course director, Dr. Chandra, and we review those at the end of the course as part of their evaluation. On the last 2 days of the course, each student gave a 15-minute presentation to the entire department. One example is a discussion of the overview of artificial intelligence in radiation oncology. Students had a final exam on radiation oncology that concluded the course. It was 48 questions, multiple choice, true, false, and 1 write-in, which included questions on general radiation oncology as well as the subsite specific questions. The average score on our first group was 80%. Students were given a pre and post test. The participant questionnaires were administered before and after the 2-week course to assess baseline characteristics and outcomes. We demonstrated an increase in medical knowledge by the end of the 2-week virtual radiation oncology elective. We asked students to write down why they signed up for the course, and some of their responses were that they signed up for the course in order to gain more exposure to the field of oncology and to understand different aspects of cancer care. They wanted to learn about a new specialty that they had not had any exposure to before, and thought that it might be one of the most engaging or interesting courses to take remotely. Some feedback from the students included that they learned a lot about the field of radiation oncology, but they wanted more interactions with residents. They thought that the lectures were a good length, consistent feel, and good quality. They wanted more involvement with patient consults, and they wanted to walk through more of the patient cases that we talked about during our contour rounds and chart rounds. They also expressed that contouring took way longer than they expected. The virtual medical student elective was initiated in response to COVID-19 and represents an important educational resource for medical students. Though this virtual rotation is not intended to replace a formal in-person elective, it was implemented because of COVID-19 and may be used to augment the educational experience for students completing in-person rotations in the future. It can decrease barriers to radiation oncology in medical schools without an academic program and can be easily implemented at any institution. This experience will help maintain the number of students interested in oncology, but more importantly, enhance radiation oncology education for all medical students who may go into other specialties. Some of our future directions and what we've been doing with our current course: each medical student is paired with a resident to go over patient cases and consults and are involved in telehealth visits. We've partnered with the ARC Bootcamp to offer this option to this cohort of students. And this may provide a model to develop a virtual visiting rotation during COVID-19. OHSU's collaborated with Stanford to bring a virtual VMRT, virtual institutional medical student radiation oncology teaching panels, so stay tuned for that. And I wanted to thank all my collaborators.